Go for it.
Okay, so all of this is going to be one component because 1, 2, and 3 muscles all kind of insert into this big flat tendon. So we'll refer to all of it as the epicranius with its components. Frontalis wrinkles the forehead. Temporoparietalis pulls tightly on the tendon. Occipitalis pulls tightly on the tendon. Epicranial aponeurosis is the name of the tendon, and they're all part of that group. Easy, buddy. Eye. 2 muscles. 1, 2. Orbicularis oculi closes the eye tightly. Levata palpebrae superioris is your eyelid blinking. Go to the nose. 1, 2, 3. Corrugator supercilii, procerus, nasalis. Nasalis flares the nostrils. Procerus, corrugator supercilii, wrinkles the skin here between the eyes. To the mouth. Smile for the camera. Come on, you can do it. Orbicularis oris goes around, like the one around the eye, round circular muscle. Closes the mouth tightly. Then you have things that insert into it. Okay? First one is right here. Levata labii superioris. Pulls the upper lip superiorly. On the edge of it, zygomaticus minor, zygomaticus major. Pull the corner of the mouth up when laughing. Minor, major. Underneath it, levata anguli oris. Pulls the angle up when smiling. On the side, coming right up the angle, straight back, right here, risorius, pulls the angle laterally, grimacing. Angle going down, depressor anguli oris, pulls the angle down, frowning, like the day of the exam, right? Depressor labii inferioris, pulls the lip down, depressor labii inferioris, pulls the lower lip down. And here, right on the chin, there's 2 of them. 1, 2, mentalis. And if they're spread apart, you get a little cleft. If they're tight, it's smooth, wrinkles the skin of the chin, and helps with protrusion or pulling the lip down and out. Mentalis. So mentalis, depressor labii inferioris, risorius, zygomaticus major, zygomaticus minor, levata labii superioris, levata anguli oris, orbicularis oris. Okay. If we go to the side, here in the hollow, this is the buccinator. It's the muscle of your cheek, and it pushes the food that's in your mouth towards the midline while chewing, or if you play an instrument and you're blowing, it helps with blowing air out. Buccinator. Here is one of 4 muscles for chewing, or what we call mastication. This is the masseter. Okay, that's 1. This is 2, temporalis. 3 and 4 are on the inside. 3 and 4. This is the medial pterygoid and the lateral pterygoid. All right, so there's 4 of them. Medial pterygoid, lateral pterygoid, temporalis, and masseter elevate the mandible. So crush the food, elevate the mandible. Okay. While we're in this area, there's 2 other muscles. One, the wide one, digastric, and 2, the skinny one, the stylohyoid. And they go from the mastoid process, digastric, styloid process, stylohyoid, to the hyoid bone, and they elevate the hyoid, not the mandible, but down in here, the hyoid bone. We'll go to the neck region and down onto the shoulders, superficial and deep. Platysma covers up this area and goes up onto the mandible, assists in opening the mouth, okay, and tensing the skin here in the area known as the thoracic outlet. Pectoralis major, pectoralis major. Pectoralis major flexes the shoulder, internally rotates the shoulder, and adducts the shoulder. Deltoid abducts the shoulder. Here you see running underneath the platysma, the sternocleidomastoid. You'll see it on the other side. Trapezius extends the neck, rotates the neck, elevates the scapula, rotates the scapula, does a lot of stuff. Trapezius. Remove the trapezius. Little triangle up here, semispinalis capitis, splenius capitis, levator scapula. Semispinalis capitis, splenius capitis extend and rotate the head and neck. Levator scapula elevates the scapula. Sternocleidomastoid. From the sternum, clavicle to mastoid process. Sternocleidomastoid. Rotates the neck, flexes the neck. Take that off. Here was the levator scapula. 3 muscles. 1, 2, 3. Posterior scalene, middle scalene, anterior scalene. 3 muscles that sit on the side. Laterally flex the head and neck. Also, the artery, the nerve bundle that supply the entire arm pass through the anterior and middle scalene and can sometimes become compressed in thoracic outlet syndrome. This wacky guy here comes from the scapula all the way up onto the hyoid bone, omohyoid, depresses the hyoid. Remove the deltoid, break the deltoid. I didn't do it. Spine of the scapula, supraspinatus, infraspinatus, from the arm, rotator cuff muscles. Remove the pectoralis major. See the clavicle, subclavius. Helps with the glide of the clavicle. Pectoralis minor to the coracoid process is what we call a protractor of the scapula, pulls the scapula forward. Pectoralis minor. And last but not least, in between the ribs, 2 layers, external layer, internal layer. External intercostal, internal intercostal. Elevate and depress the ribs during breathing. Okay. There's some more hyoid muscles here. Okay.